nothing short of revolutionary. So, how does AI-driven surgery work? Let's delve into the mechanics. The heart of AI-assisted surgery is a blend of robotics, programming, and machine learning. Robots are meticulously programmed to assist in surgical procedures, performing tasks with a level of precision that surpasses human capabilities. These robots aren't autonomous, though. They're controlled by human surgeons who guide their movements, ensuring safety and precision. But where does AI come in? Well, that's where machine learning steps in. Through machine learning algorithms, these robots can learn from each procedure, improving their accuracy over time. The more surgeries they assist in, the better they become, learning to predict potential complications and adjusting their movements accordingly. This doesn't replace the surgeon, but rather enhances their capabilities, providing a tool that learns and adapts. With the right programming and a human touch, AI-driven surgery is revolutionizing the medical field. The impact of AI-driven surgery is far-reaching, promising a new era of surgical precision and patient care. By harnessing the power of artificial intelligence, we're witnessing a revolution in the surgical arena. Imagine surgeries with higher precision, minimized human error, and improved patient outcomes. That's the potential of AI-driven surgery. This technology not only has the potential to improve surgical outcomes, but also to reduce recovery times and minimize surgical complications. Imagine a world where post-operative complications are significantly reduced and recovery times are halved. That's the world AI-driven surgery is creating. Yet, this brave new world is not without its challenges. Ethical considerations around machine autonomy, the potential for malfunctions, and the need for robust regulation are all pertinent. We must tread carefully, ensuring that this technology is used responsibly and ethically. As we stand at the cusp of this new era, AI-driven surgery holds the potential to redefine the future.